Hi, I'm Dr. Charlotte, and I am here to start my billing and code update for July 31st. The topic of today's lecture is, what is an RVU? Well, an RVU is a system that the government came up to value medical services. So, for example, if you have a C-section, they have decided there is a certain number of work values associated with it. The government evaluates the value of RVUs yearly. They change the values of the services. For example, I'm an ophthalmologist, and some ophthalmologists do cataracts. So before, cataracts had a value of, say, 10 RVUs. Well, they decided that the procedure of cataract surgery had become more efficient and less time was needed to do the cataract surgery. So they actually decreased the valuation of cataract surgery to an 8. So some physicians are actually paid by RVUs. So some hospitals will say, well, it doesn't matter what patient you see. If it's a patient that has Medicare, that doesn't have any insurance, that has Blue Cross and Blue Shield, it doesn't matter, we'll pay you the same for any patient based on this RVU value or scale. And they often make your base salary based on RVU. So, for example, if they tell you that we're going to pay you $200,000, for $200,000, you have to make 10,000 RVUs. Well, if you don't know what an RVU is, you don't know how many patients you have to see, how many procedures you have to do, or just examinations you have to do. Let me share some of the RVU values for you for a new patient exam. So a new patient exam code is Well, let's a new patient exam code is 99204. That's in the level 4 new patient visit. That RVU value is 2.4. If you go down to the level 3 new patient visit, that's 99203, that value is 1.4. So what does that mean? So if, say, you were a doctor, sorry, my phone is my calculator. If you were a doctor and you had to see to get approximately 30 RVUs a day, you would, if you saw all level 4 patients, you would have to see approximately 10 level 4 patients. If you had to level 4 new patients, if you had to see, to earn 30 RVUs a day to make your salary, you may have to see 25 patients. And so you see how if somebody tells you 10,000 RVUs, that may not be reasonable for your specialty. So I was looking online, the average RVU value for a family practice physician is 4,600 RVUs a year. Average daily RVU output for a family practice physician is 18.4 RVUs, and the average code that a family practice doctor bills is 99213, which is approximately 0.9 or 1 RVUs. So the reason why I share that you need to know how much an RVU is worth is because you have to use that multiplier by what dollar amount they're going to give you, so you're able to calculate your salary. So I had a friend who worked for a hospital system, and they started her off at the 90th percentile of RVUs, and they told her that they were going to give her $50 an RVU. However, the 90th percentile in her specialty was 8,000 RVUs. That she was a family practice doctor. She was doing outpatient, so most of her RVU visits, most of her visits ranged between 2.4 RVUs and that 0.92 RVUs, where that 99213 is being billed. So even if she saw 18 patients a day, the most she could get was anywhere from 18 to 25 RVUs. You multiply that over the course of a year, unless she's doing procedures or unless she is seeing a lot of complicated patients in the hospital where she's billing daily an RVU, an RVU, an RVU for quick follow-ups, she wasn't successful in earning a salary that was anywhere close to what she had started out with and was guaranteed for the first 18 months. And when her salary dropped down to the 10th percentile and she was only really making about 15 RVUs a year, she was really upset. And then things that compound the business or the growth of your practice is if other doctors are started at the same time. So an RVU is actually just a method to calculate your reimbursement. However, you need to know what the RVU value is for your most frequent codes. You need to take your RVUs that the company wants you to make a year, divide it by the week, divide it by the day. See if that's something realistic, that you can see that many patients a day. If you're in a procedural field, you need to know what your most common procedures are and how many RVUs that provides. I'm an ophthalmologist, a pediatric ophthalmologist by subspecialty, so I do a lot of eye muscle surgeries. One eye muscle case will gather me 8 RVUs. So if I have a full surgery day of 6 muscles, 8 times 6 is 48. So that is actually a good day. So that day pays for part of my vacation the other week. But if you're a family practice doctor where you don't have those procedures that bulk and group your RVUs, it's like putting 1 penny, 2 penny, 3 penny, 4 penny, but you really need to make a dollar. So it's important as an RVU physician to know exactly what the RVU is, to know exactly how much your RVU conversion rate is. Now, a lot of people will tell you, oh, well, it's just better to be paid as an RVU physician. You don't have to worry about, anything. But even RVU physicians have to worry about limited resources. For example, you get the same RVU for a Medicaid patient as a Medicare patient or even a private pay patient. But if your staff, and everybody has a limited amount of staff, if your staff has to take 3 times as much time to pre-cert the medicine and pre-authorize the medicine for a Medicaid patient, then you may not want to fill your practice with Medicaid patients, even though technically you will get the same reimbursement from your employer as a private pay patient. So today's talk was just to educate you about the RVU, making sure you know what your codes that you use in your specialty, and if you have any procedure codes, know what the RVU value is for that. And then also just knowing that RVU is just a conversion factor on how you're going to be paid. All physicians need to be reimbursed for their work. Several hospital systems do use the RVU method so that you don't feel forced to cherry pick patients. However, sometimes it is important to, have patients with less administrative paper burden. So you'll have a staff to help you fill out their paperwork, their pre-authorizations, their MRI forms, and paperwork. That's all I wanted to talk about today in the billing and coding moment, knowing about an RVU, and I hope you will join me next week for another wonderful topic. Have a blessed day. Goodbye.